Hello again, this is David. This is video segment 4, and I wanted to talk about the second treatment option you have after you find out you are at least at a stage 3. So in the last video I talked about the lymph node dissection, and that's a surgical process, and now I want to talk about the chemical treatment, typically interferon, that you would do. And again, this is really to try to kill any cancer cells that might have escaped that original lymph node area and traveled to other organs, but that might be too small to see with a PET scan or whatnot. So anyway, there are different options for this type of treatment. Interferon is the standard of care treatment. It's been in place for a long time. You'll find many people who have gone through this process. Essentially, the way that works is there's 2 phases to it. The first month, you essentially get a treatment Monday to Friday every week for 4 weeks. It's also a higher dosage and has more impact on you in terms of side effects. After the first month, you go on a 3 injections per week basis. So that's called the maintenance mode. So 3 times a week you'll get a subcutaneous injection, so a shot, and they'll deliver the medicine that way, whereas the first 4 weeks are always done via IV. That second maintenance mode goes on for 11 months, so the total treatment is 1 year. That's the standard, been around for a long time. There is other options. Another option that at least was offered to me was a clinical trial using Cytotron. Now, Cytotron is the same medicine. It is interferon. It's just a slow-release interferon. So instead of going every day, you go once a week for some period of time for the original part of it, and then, again, for the maintenance mode, there's some period of time that you go. It's typically a little longer than a year. Maybe a year and a half or 2 years that you have to stay on the Cytotron, so it's a little bit longer, and that was one of the reasons I didn't like it. But the primary difference between the two is with interferon, they inject the interferon into your body, and it's all there and working immediately, and so you tend to get side effects rapidly, and then you'll get better again, typically over a 12-14 hour period, I believe. Everyone's different, of course. And then you'll feel a little bit better until you get your next injection. And so it's very cyclical. With Cytotron, it's a slow release. So you go one time and get a shot at the beginning of the week. And it's a more even response. So you don't have the same highs and lows, but the response isn't as bad as it might be on the bad side for an interferon injection. So if you can kind of follow what I'm saying there. Those are the 2 different interferon treatments that I had available to me. I chose interferon, the standard interferon, for a couple of reasons. One, because I just wanted to know in a year I'd be done. I didn't want this to potentially go on for a year and a half or 2 years, and that was probably the big reason for me. The other was I like the idea of having good periods. So the bads are probably a little worse with interferon than they are with Cytotron. But one of the ideas that was floated to me is that you can get your interferon treatments late in the day, and the effects will start to take in that evening, and you can sleep through a good part of it perhaps, and then be a little bit better the next day until you get your next interferon treatment. So I like this idea that I would have better times and not always kind of be down and so forth with the side effects. But there may be some other factors you might want to consider. I think with Cytotron, given the more steady state nature of it, it might be a little bit easier to put into your work schedule, right? So depending on how flexible you are with work and so forth, it may be a consideration for you. So I chose interferon, the standard treatment, and that's what I've begun. I do want to make one note, though. There is other clinical trials out there, and you should ask your doctor what exists. Now, in my case, at this point in time, there was a clinical trial for a drug called Yervoy. It's spelled Y-U-R-V-O-Y. That's the marketing name. The actual drug name is, and I have to look at this, it's ipilimumab, which I'm sure I'm butchering, so I'll spell it for you, I-P-I-L-I-M-U-M-A-B. if you want to do any studies of that drug, look that name up as opposed to Yervoy. You'll get a lot more data. But in my case, it wasn't really an option because the clinical trials were only for people who had hit stage 3B, and I was 3A. So it really wasn't an option for me. But it's been very promising in stage 4 patients, and now they're doing stage 3 patients as well, or 3B and above. And so it might be something to be interested in looking at. So ask your doctor. I did get my first interferon treatment this very day. It finished, it's about 10 o'clock now in the evening, and my treatment finished at 5:30. I was told by my doctor that the first day, because your body is not used to this interferon, you will almost certainly have a reaction, which will be severe flu-like symptoms, which will probably include body aches, fever, and chills, things like that. Now, these are all things that you'll have felt before if you've had the flu, but those are the kinds of symptoms that you typically get. And he told me that they would most likely be more severe today than they will be tomorrow, and they'll probably get a little better over time. I'm happy to report it's 10 o'clock. By his, thoughts, that would have already occurred to me. But at this point, I still feel really good. I do have just a slight headache, but it's really very mild. I kind of do expect this to hit me later in the day, probably, or in the evenings, probably as I go to bed or whatnot. But I'll tell you more about what happens tomorrow. At this point, I still feel great with no issues at this point.